A new strain of COVID-19? I've got everything you need to know about it and which countries it's hitting hard. If you've watched the news this week, you may have heard that a new strain of the coronavirus has been identified in the UK. If that's not enough to raise an eyebrow, this new COVID-19 strain appears to be spreading faster than the other existing strains of the virus. So far, over 1,000 cases caused by the new coronavirus strain have been identified, mainly in the south of England. Some news outlets are reporting that the numbers are increasing rapidly. The discovery of those new strains has sparked a lot of questions, such as if the current COVID vaccine is still effective against it, how do these new strains even occur, should you be concerned, and has the new strain emerged anywhere else besides the UK? Today, I will go over all the questions that you want answered. Hey everyone, I'm Dr. Jordan Wagner. I'm an ER doctor. And make sure you subscribe to my channel, that way you are informed of all the latest medical information out there. Viruses in general naturally evolve as they move through the population. Some viruses, however, more than others. It's one reason we need a fresh flu shot each year. There are new variants or strains of the virus. Similarly, new variants or strains of the virus that causes COVID-19 have been seen almost since it was first detected in China nearly a year ago. In fact, infectious disease doctors have reported nearly 6 different strains. This new strain in the UK specifically was first identified in southeastern England in September and has been circulating in that area ever since. Because of the new strain of COVID-19, Prime Minister Johnson announced new restrictions, and several European Union countries have banned or limited some flights from the UK. This is an attempt to try or limit further spread. So what's specifically concerning about this recent strain? Health experts in the UK and United States are reporting that the new strain seems to infect patients more easily than others, though there is no evidence thus far that it is more deadly than any other strain. The British government's chief scientific advisor said that the new strain, quote, moves fast and it's becoming the dominant variant. This having caused over 60% of COVID infections in London by December. Under the microscope, it seems that the new strain has mutations that are on the spiky protein that the virus uses to attach to and infect our cells. The spike section of the protein is what current vaccines are targeting. So how do these new strains occur? Viruses are microscopic infectious agents that replicate only inside a living cell of an organism. They lack the capacity to thrive and reproduce outside of a host body. So as viruses move through a population, the host body adapts or fights against the virus. Viruses often acquire small changes of a letter or two in their genetic alphabet just through normal evolution. The virus too has to adapt and evolve. A slightly modified strain can become the most common in one area or one country because that's the strain that first took hold there or became more dominant. Sometimes superspreader events or outbreaks can lead to one strain over another becoming the dominant virus strand in a particular area. The greater the worry to the infectious disease specialists or ER doctors like myself who battle this every day in the emergency department is when a virus mutates by changing the proteins on its surface to help it escape from drugs or the immune system. If we figure out a treatment for COVID-19 and it mutates, we may also have to adapt our treatments or vaccine in the future. Will the new strain undermine vaccines? That is a major question. But scientists say that there's no evidence that the vaccines currently being deployed in the UK made by Pfizer and BioNTech or other COVID-19 vaccines in development will not protect against the variant. Vaccines produce wide-range responses by the immune system beyond just those to the spike protein. The possibility that new strains will be resistant to existing vaccines are low, but not non-existent. This particular variant in the UK is very unlikely to have escaped the vaccine immunity. Does the new strain affect testing? The answer is somewhat. One of the mutations in the new variant can affect one of the 3 genomic targets used by some PCR tests. This means that in those specific type of tests, that target area of the test would come up negative, even if you were positive. This is mainly due to the PCR tests generally detecting more than one gene target. A mutation in the spike protein only affects part of the test, reducing the risk of the false negative results. This strain has not mutated so much that if you truly do have COVID-19 and take the test, it should come up as a true positive for COVID-19. Are new virus strains active anywhere outside Britain? Strains of the COVID-19 causing virus have emerged in recent months in South Africa, Spain, Denmark, and other countries that have also raised concerns. Scientists in South Africa have detected a strain that shares one of the mutations of the new variant in up to 90% of the samples that have been genetically sequenced since mid-November. Evidence suggests that the two variations have arisen separately. This has resulted in higher viral load in swab tests, meaning that it is also more transmittable. South Africa, the hardest hit nation on the continent, is currently experiencing a second wave driven in part by this more virulent strain and in part by the behavior that is undermining public health measures throughout the pandemic. At a World Health Organization meeting earlier this month, scientists reported that the new variant made up to 80 to 90% of the infections in South Africa. So the big question, should we all freak out? The coronavirus is not to be taken lightly. You should definitely take precaution, practice proper hand hygiene, and social distancing precautions as we have been doing for months. But the thing to remember is viruses mutate all the time. It's a natural occurrence that happens as the virus replicates. Just because there's a mutation doesn't mean we should all start freaking out. Many mutations have no effect on the virus as there is a lot of redundancy in the genetic code. The ones that help the virus survive and spread more easily are the ones scientists are keeping an eye out for. Some mutations are actually harmful to the virus itself and make it harder for it to spread. Those will quickly disappear from the population. Unfortunately, the new strain identified in the United Kingdom does contain mutations that are in the spike protein, which could allow it to spread more easily. This is still being studied as to whether this is indeed the case. As the COVID-19 pandemic continues, it is important to remain vigilant, no matter where you are. Even if you've already been vaccinated or have recovered from a COVID-19 infection, it's necessary to continue to follow all recommended precautions. All right, there's been a quick update with me on the new strain of COVID-19. Let me know if you have any more questions. Please leave me a comment below. And as always, make sure you subscribe and turn those bell notifications on. Thank you so much for watching and stay healthy, my friends.